Hello, welcome to another episode of the Parent Advocacy Program. My name is Ray Guthrum and I'll be hosting the show for you today. And come right back, I introduce you to my guests and we'll get right into the program.
Next case.
The People versus Martin White. Mr. White has been charged with...
Guilty. Next case.
But Your Honor, you haven't heard the charges yet.
Guilty. Next case. Guilty. 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 Life in prison. Guilty. Next case.
Hello, welcome back. My name again is Ray Guthrum and I'm hosting today's program. To give you the mission statement of the Parent Advocacy Program, for all of you who do not know, the Parent Advocacy Program was designed to educate parents with special needs children. The collaboration of various agencies and services in and out of Western New York. Today on today's show, I have with me my special guest who I'll allow to introduce yourself to the John Q. public, please.
Thank you. My name's Dr. Deanne Wells. I am a pediatric dentist with the University of Buffalo School of Dental Medicine. I also see children at Children's Hospital and Mercy Hospital and a couple offices in the community. I specialize in children's dentistry.
At the dental school, at Children's Hospital and other clinics, what are some of the most common dental problems you may encounter?
Very good. I'm glad you asked. The most common dental problem we encounter is actually a fractured front tooth, so a broken front tooth. And with it being the summertime and it's getting warmer and the kids are playing out there, ever so often we have children either fall off their bicycles or just playing rough and they fall onto the ground, the pavement or whatsoever, and break their front tooth. We see probably 5 cases a day at Children's Hospital just with that problem. And it can be something very simple to something complicated. And the most important message is however that tooth breaks, they need to get to a dentist.
If a child's playing basketball and his front tooth gets knocked out, you already answered the question about what should they do. I mean, is there like an on-site little first aid that should be administered first before rushing off to the dentist?
Absolutely. When a tooth gets knocked out, that's called avulsion. And I should tell you there are different things that can occur to a tooth. If they're playing basketball and their elbow, the tooth can actually get pushed in. That's called intrusion. It can move to the right or the left. That's called luxation. There can be what's called a laceration, so a tear in the lip, or the tooth can fracture, as we talked about before. But if it gets knocked out completely, time is of the essence. They need to get to the dentist within the hour. And the other issue is, anybody who sees that tooth, and I have a tooth here that I can show you, if the tooth comes out completely and it's an adult tooth as compared to a baby tooth, and you'll know it's an adult tooth because it will be larger, it will have a longer root, the child will be a little bit older, say over the age of 8. What the person that's with them needs to do is to hold the tooth by the crown part of it and try to replace it. Now, as you know, not many people like dealing with other people's mouths, so you may not be with somebody who wants to put the tooth back in. So the other thing to do is to place the tooth, again, trying not to hold the root of the tooth, but just the crown, to place it in a glass of milk, and if you haven't got milk, to place it in a glass of water.
And you would plant it over again?
Yes, it can be replanted. So as soon as they get to the Children's Hospital or whatever dentist they're going to, hopefully they're going to a pediatric dentist because this is what we specialize in. We will replace the tooth into the socket after taking x-rays, and we will then bond the tooth to other teeth, sort of what you would see on a child that's wearing braces. And that will hold the tooth in place. And then after a couple appointments, we do a root canal on that tooth. But it's a beautiful thing to save a tooth on a child who just had an entire tooth knocked out. So that would be the treatment.
Well, most people I know are afraid of root canals. You just answered half of my question. My question was going to be, how would that tooth stay in place? And you already say you would cement it and then do a root canal.
Yes, yeah. We bond it to the other teeth by braces. And those braces won't stay on forever. It just stays on for a week, sometimes 2 weeks, depending on the stability of the tooth. So the tissue actually will regrow and attach to that tooth. but the tooth is dead. Once it has left the mouth, it dies. The blood supply, the nerve supply to that tooth is no longer there. So the only option at that point, depending on how old the root of the tooth is to do a root canal.
You know, when I was younger, that did happen to me, but funny you should mention that because my tooth turned black.
Yes.
They went straight back. I was playing basketball and I got a head to the mouth.
Yes.
But the color came back. I didn't go to a dentist. I just pulled them back up.
Yes, yes.
And they eventually, after a long period of time, they did restore the
Yeah.
whiteness and the color did come back.
And I guess that's what I'm saying. If you're on the basketball court and the tooth gets knocked out slightly, if it's not completely out, and you're comfortable replacing it as you did or moving it back into position, I highly recommend doing that. Because the quicker you can get the tooth back into the tissue that it belongs, the prognosis for healing is much better. And so your tooth discolored because the blood supply was cut off for a little while. But because of your quick action to get it back into the position it needed to be, the blood supply probably regained and it probably lightened up after time. You know, and maybe you didn't need the root canal in a case like that because of your quick timing. So you can be your own little dentist, and there are things you can do to make the whole process easier for you in the long run.
So it sounds to me like children playing sports, naturally everyone playing sports should have a mouth guard.
I
Is
wish
that
it was
correct?
that
You
easy.
recommend that?
I totally recommend it, but you know it's not going to happen. But ideally, especially if it's a contact sport, so not just basketball, even soccer, football, of course. And I know the teams out there are making sure that their players are wearing mouth guards. But even if kids are playing on the street, my dream is that every child will have a mouth guard in. It's not just about the fractured front tooth or the tooth coming out, avulsion, but also brain injury. We know by research that if they're wearing a mouth guard, they're actually protecting their brain from injury by that clenching action on the mouth guard. So the mouth guard plays a big part, not just in terms of the oral cavity, but the brain as well. So ideally, I wish every child would wear a mouth guard.
Considering that children play sports year-round, is there a season that is more prevalent than others?
Yeah, we tend to see it a lot with our inner city kids in the summertime, and then on the outskirts of Buffalo in the winter with the skiing and snowboarding. But really, summer, it's already begun at Children's Hospital, and I have to let you know, we have dental residents on call 24/7. So if there is an injury, you don't need to sometimes rush to the emergency room. While you're gathering your thoughts and trying to evaluate what's going on, somebody can call Children's Hospital's emergency room or just the main number, 878-7000, and ask to speak to a dentist. And you can talk directly to one of our residents or to myself and ask questions. I just knocked my tooth out. I don't know what to do. Can I come right in? And it will really save a lot of time in the emergency room, but it will also quicken the process for healing. So I would say yes, in the summertime, it's more prevalent, the injuries that we see. Kids are out there more, they're staying up later, you know, the weather is good. In the winter, we see fewer, and it's mostly associated with skiing injuries.
Well, I was thinking, you know, there's basketball, football, all those different school activities. There's just gym, you know, a lot of things. And naturally, there's more children outside playing during the summer.
Yes.
But I was thinking, that's why I asked that question, because I was wondering if it balances itself out as to where and what season do they have the most accidents.
You know, that will make a great research study for one of my dental students. But even pool injuries, you know, swimming and their eyes are closed and they hit the side of the pool. So it really varies what you see and the type of fracture, the type of dental trauma that you see with it. You're right.
Just a few questions about dentistry. First one being, what can we do to keep our children cavity-free, especially since some of us are afraid of going to the dentist?
Absolutely, great question. Well, you picked up on the first thing, which is fear of going to the dentist, and we still get that a lot. Even when I take my programs into the Buffalo Public Schools, for instance, we'll have teachers that will say, oh no, the dentist is here. So it's instilling that fear in the child. So the first thing I think that you can do is to not instill the fear of dentistry in a child. Because as you know, as an adult, if you're afraid of going to the dentist, you're not going to go to the dentist and your problems only become worse. The face of dentistry is changing, and I am working very hard in the dental school to ensure that the dental students we graduate are dental students that are caring to the community, so that you don't have to be afraid of their treatment. What can we do besides that? Of course, the basic brushing, flossing, which we'll demonstrate today, good diet, making sure that we're staying away from cavity-causing food stuff, but also getting the child to the dentist as early as possible. And we as pediatric dentists, according to our guidelines, see children at the age of 1. So at the age of 1, you should already be looking for a dental home for your child. So your child is growing up with us, and that way they won't be afraid of coming to the dentist. And also we're making sure that they're not at risk for dental diseases that will result in things that they would be afraid of. So there's quite a bit you can do, but the number one thing is reducing the fear and just making the community aware, which is what we're doing on a show like this today.
You recommend flossing daily or?
Absolutely, flossing daily. And there's a nice little trick to flossing. You actually can leave the toothpaste on your teeth and floss the toothpaste in between your teeth. And that, it puts a little twist to it, but it's also taking the fluoridated toothpaste in between your teeth. But daily, you want to remove the plaque from between your teeth, the same way you're doing it from in front and behind and the top surfaces of your teeth.
Any other helpful tips or hints that you can give to our viewers
Sure.
about how to prevent cavities and how to treat certain little illnesses such as that?
Sure. One of the messages I really want to get out there is the Gatorade. Gatorade and soda pop, very bad for your teeth. And I know a lot, again, about athletes are out there drinking the Gatorade. So what I recommend is drinking water right after the Gatorade. And the other thing is, in the summertime, I see so many kids at the corner stores buying the potato chips and the junk food and things like that. Please, if they can reduce that, in between your meals, it's better to just have water and fruit and leave those snacks for when you're having your meals. Brushing frequently is still the number one thing to remove the plaque off the teeth. Is still the number one thing to do. And for those of you that have cavities or stain or some lesion, make sure you visit your dentist, because it's only going to get worse unless we can intervene.
While we're there, we always hear about what's bad for the teeth. Seldom do we ever hear what's good for the teeth.
Good question.
Can we send that out there?
Yeah, sure. In countries like Sweden, actually in the grocery store, they put smiley faces and sad faces on the food so people know what's dentally healthy and what's not dentally healthy. So good for the teeth, of course. Water for me is the number one thing, especially fluoridated water. And I recommend, again, in between meals, have your children drink water, not Kool-Aid, not soda pop. In terms of foods, fruits and vegetables, just like your grandmother told you years ago, it hasn't changed a bit. Stay away from things like fruit snacks. It's just a trick to get you to eat candy, pretty much. Chewing gum, not a bad idea if it's sugar-free chewing gum, and especially one that contains an ingredient that starts with the letter X. It's called xylitol. Xylitol is an anti-cariogenic ingredient, so it actually prevents cavities from forming. So it's really a great thing, and we recommend that to a lot of teenagers that I see with a lot of cavities. I'll say, do you like chewing gum? Yeah, I chew Bubblicious. Stay away from the Bubblicious. Move on to something like Orbit or Trident that's sugar-free and that has that ingredient that starts with the letter X, xylitol.
According to estimates, over 1 billion people live in appalling levels of poverty. Denied even basic standards of food, water. Nearly half of the world's population earns less than.
Hello, once again, my name is Ray Goodrum, here with the Parent Advocacy Program. Along with me today, I shall reintroduce Dr. Dion Wells, pediatric dentist from the UB School of Dental Medicine.
That's right.
I stumbled, but I got it right.
That's right, you did.
Okay, before we went on the break, we were talking about University of Buffalo School of Medicine. Can you just tell them a little bit about what you do there and how you do it?
Sure. Dental school is 4 years, and we get students from all over the world. I teach the freshman dental students, so the first year, and that's really good for me because they're very enthusiastic. And I teach a course called Profession, Practice, and Community, which allows me to take these 80 dental students into the Buffalo Public Schools, the Head Start, special needs homes, geriatric centers to run dental outreach programs. Now, of course, they don't know too much dentistry just yet, but they know how to at least raise the dental awareness and the dental IQ of the community. So they go out and teach clients how to brush and floss and what causes cavities and how to pretty much take care of themselves.
Sounds like a big job you got going for yourself.
It's fun.
Today you're going to give us a little demonstration of
Sure.
of how you do what you do,
Sure.
and kind of explain it to us a little bit what you're going to do before you get into it.
Sounds good. So I brought my son Jamal in with me, and he's a really good patient case to bring in because we talked about the fracture of the front tooth earlier. And Jamal actually, when he was maybe 12 years old or so, did break his front tooth.
On this trip to Hawaii.
That's right, on a trip to Hawaii. And so for a tooth like this, again, you want to get to the dentist as soon as possible. And we're in a hotel, so, there is no dentist but me. And I was very fortunate that a dental clinic in the area allowed me to use their center to rebuild his tooth.
He was very fortunate to have a dentist for mom.
I guess so. So in a case like this, the first thing you will do is to take an x-ray. And the x-ray is simply placed in between his teeth. Bring in the camera, something we don't want kids to be afraid of at all. We tell them it's a cookie that they're going to bite on, and we can get a shot of their face.
Does that work?
It does work for some kids. And the x-ray will end up looking something like this, or
Okay.
a smaller one, that we can identify whether the nerve of the tooth has been hit or not. So that's the first thing I wanted to talk about with him. The other thing I wanted to point out before we move into dental hygiene is the mouth guard. Now, this is Jamal's mouth guard that he uses for hockey. And it is a boil and bite that you can pick up at any drugstore.
A boiling
Boil
bite.
and bite, meaning
Meaning?
you boil the water, you place it into boiled water, you take it out, you place it into the patient's mouth or your kid's mouth and have them bite on it, and it forms around the teeth. And this is good for children that are in between losing teeth. So a child between the ages of 5 and 13, 14, 15 years of age. But once they get older, and if they're playing football and other things like that, you want to go to a dentist and have a properly fitted mouth guard made.
Oh, and that's the first I heard of that because I used to play sports and we just go buy a mouthpiece and stick it in our mouth and go play.
Yes, yeah. And what probably happened was it was loose, and as Jamal so nicely demonstrated here, you started chewing it, and maybe it slipped out every now and again, and that means that when you really need it to work, it's going to be loose and may not function as well as the one that's made at a dentist. So my dental students actually have come up with a program called Safeguard Your Smile, where they will make mouth guards free of charge for certain groups out there. So I think
good to know.
Yeah, we are working with certain basketball teams and football teams to make their mouth guard for
Is
them.
that college or high school? Or?
High school and middle school. I think we just made them for middle school kids at one school. So that's
So
really
now we're getting ready to
interesting.
pull a tooth, or what
Oh,
are we going to?
yeah, I know. Jamal, would you like me to take a tooth out for you? No. So I thought it would be nice if I could demonstrate brushing and flossing, basic dental hygiene, because we talked about that is still the #1 way to prevent dental decay. Of course, you want to use a good toothbrush, but you want it to be a soft toothbrush, not hard, not medium, a soft toothbrush.
I was always told firm was better.
I know, and I come from the Caribbean, as you could tell by my accent, and everybody uses a hard, firm toothbrush on there.
They figure they need that to get rid of some of that.
I
gunk
know, but you take a look at their smiles now, and their gum tissue has receded. So the hard toothbrush brushing against your gums is actually damaging your gums.
Okay.
A soft toothbrush with the right technique of brushing and the proper toothpaste will do the job just as well. So you want to use a soft toothbrush as much as possible. Then we talk about toothpaste, and any type of toothpaste is fine, especially if it says approved by the American Dental Association. It will say the ADA. The kids, of course, love the watermelon and the flavored toothpaste. The problem with that is that they are swallowing the toothpaste. And
Well,
toothpaste
does that do
contains
any
fluoride.
damage? Does it do any harm to your?
It does. Toothpaste contains fluoride, which can really make them very sick. It's actually, if somebody was to eat a tube of this size, it can poison them.
Ooh.
So you want a child to use a very small amount of toothpaste. We usually say the pea size, the size of a pea, as little as that. And on some toothbrushes, there's actually a little indicator that will tell you where to put the toothpaste and how much.
Okay.
Now, I know on television you'll see the big swab of toothpaste, you know, because the more you empty it, the more you have to buy.
Well,
But
yeah.
really, you want to use a small amount of toothpaste, okay? Proper brushing, and I'm just going to wipe some off, means brushing round and round in circles and angling your toothbrush so some of the bristles are getting under the gums. That's where the bacteria, the plaque, is going to hide. They know you're coming to brush them off, and so they're going to tuck underneath the gums. And so the most important thing as you're brushing is not just to brush the teeth, but to make sure the toothbrush bristles are tickling your gums as well. That's what I tell the little kids.
So that doesn't damage your gums by hitting it with those bristles.
Right, because it's a soft toothbrush, we know it's not going to damage their gums. Then we just brush the front of the teeth. Of course, we'll go all the way around, but you want to get behind the teeth as well. Make sure you're getting all the surfaces. You can hold your toothbrush up and down, and it's going to tickle a little bit there as you do that to get behind the teeth.
He look like he's having fun,
I think he is.
since he doesn't have to do it himself.
I know. One of the things we talked about was leaving the toothpaste on and then flossing. And flossing is something that people don't usually do, but we really want to get, everybody in Buffalo flossing as much as possible. Take a nice length, wrap it around your middle fingers, hold it nice and tight, and then the idea is to not do it this way that you see most kids doing, the sort of whiskers way. You actually want to take 2 teeth at a time, slide the floss in between, pull it to one side, and then move it up and down like this. And then you go to another 2 teeth, slide it in between, move it up and down, move it up and down.
Now, if that's done improperly, you can cut your gums, right?
If you do it improperly, if you're slamming it up there, it's possible. Now, they're making the floss though so much nicer now. One of my favorites is this one. If you're having problems where you feel like you're cutting into your gums, you want to use something a little softer, a little more rope-like. And this one is very interesting. It actually has toothpaste in it already. But I'm sure Jamal can tell the difference. It's not as tough on your gums. When it slides through, it's nice and soft, wraps around the tooth, does the job just as well, but it's soft. So you have quite a variety of dental floss out there to choose from to find the one that you're most comfortable with.
Would you recommend someone who's just starting to get into flossing? Which one would you recommend?
I
The
would
softer one?
recommend Definitely the softer one. Definitely the softer one. And they also make a type that's attached to a toothpick, and that's fine too. That's absolutely fine too.
How often do you recommend flossing?
Every time you brush, so that would be ideally 3 times
Brush
a
and
day.
then floss, or
Yeah,
floss and then brush?
floss. I like the brush and then floss because you can leave the toothpaste on there, and you can take the toothpaste in between the teeth to help clean between the teeth as well. Sounds good.
That's good to know.
Yeah. Now, at a dentist, when you come in, these are our 2 basic tools. And you'll find a lot of kids will be, afraid of the pointy thing. And what are they afraid of at the dentist? They're afraid of the shot.
Right.
And so that's something we really try to work around. We try to explain is to take the pain away. You will hear us as a pediatric dentist call it sleepy juice or nummy jelly. We have the opportunity to use laughing gas to make them comfortable. And we will make sure that we put some gel on and that they do not feel it as we're getting their tooth numb. And so even getting them used to something like this, the Explorer, I would usually put my finger on top of it as I place it into the mouth so that it's not going to touch their gums. We know what we're doing. We know they're afraid. And then very gently, this is a basic tool that's used to tell whether a child has a cavity or not. If this sticks in a tooth, and if it sticks in one of your teeth, Jamal, you're in trouble. But if it sticks in a tooth, then you know that you have a cavity. If it moves nice and smooth along the tooth, then you know you're just fine. So when you come to a dentist for a first appointment, this is what we like to do. We like to check for cavities. We'll take x-rays, we'll talk about how to brush and floss. And of course, I have to track back a bit because I said to you a child should come to the dentist at the age of 1. For a child at the age of 1, they're never going to sit in a chair. I should not say never. There are times they do. But at the age of 1, they'll probably sit on mom's lap or dad's lap or grandma's lap, and they will be leaned back into my lap. And I will look over and pretty much use a toothbrush to check their teeth and to clean their teeth and to apply the fluoride that needs to strengthen their teeth, and have the opportunity to talk to the caregiver about how to prevent cavities from forming on that child.
So when a child comes to you for the first time, they're petrified, or are they not?
Some are. I would say Especially those whose parents were petrified, or who on the way get into the dentist, the big brother said things like they're going to pull your teeth out, and there's going to be blood, and there's going to be a shot. So my message is to really to make things easier for everybody, not just me, but for that poor child who's staying up all night worrying about coming. Tell them the good things. Tell them it's going to be okay. Tell them the dentist cares. This is a profession of love. And I tell my dental students, if they cannot love that perfect stranger and care for them the way they would for their own child or mother, then they do not need to be a dentist. So hopefully we're growing dentists out there that are going to respond to the good things that you're telling your child that you are bringing to the dentist, and we'll just have a perfect appointment, no crying, everything's fine, and they will enjoy returning every 6 months for their appointments.
But there's so many people who are so deathly afraid of dentists. I mean, children as well as adults.
Yes.
Most of them that I know, especially the female, they want to be put to sleep. Is that recommended, or?
Yeah, it's very difficult to find a dentist that will put their patients to sleep. Nitrous oxide, there are other sedations that we can give you, but really, to have a patient put to sleep, they have to be very compromised health-wise. So to have other problems going on that indicates this is something we need to do. It's more important to pattern a patient, and we do this with our special needs patients. You can imagine if a non-special needs adult is afraid of coming to a dentist, imagine a special needs adult or a special needs child. So what we do is called patterning. The first appointment may be not even doing anything but sitting in the chair and talking and getting to know the patient, getting to know them as a friend, not a patient. The second appointment, maybe we brush their teeth. The third appointment, we bring out the Mirror and Explorer, and then we need to do a filling and we put topical. But we've built a relationship of trust. People are afraid of going to the dentist because they do not trust the unknown. They
Yes,
don't
sir.
know who the dentist is.
Well, the unknown is very frightening.
I know.
Some great information you have in here, but time is winding
Oh,
down.
okay.
And like everything else, we're running out. But for our viewing audience, what information would you like to give to those people who want to know more about your services that you provide?
What I'd like to say is that we can be reached through the dental school. I wish I could give you the phone number, but you can always call the station and get it from us. I'll leave it here. We have outreach programs, but we
We'll
also...
put it on the bottom of the
That
screen.
sounds good. We also have programs that will bring you to a dentist that you feel comfortable with, because we know you're afraid. We know that there are barriers to care. You may not have the right insurance. You may not have transportation. You may not know of a dentist that will be the right dentist for you. We have programs at the dental school that can help with that. We have social workers at the dental school that can help break those barriers to care.
Okay.
So, most important message is don't be afraid to find out what your needs are as a patient, because
hear that?
we'll try and connect you with the right dentist to do the right thing for you.
Okay, I'm afraid we ran out of time. I hate to cut you off because we're
That's
rolling
fine.
pretty good there finally.
Thank you.
But I'd like to thank my guests, Dr. Deanne Wells and Jamal. Mr. Jamal Wells, for being our guinea pig today. And if you want additional information, read the number that's on the bottom of the screen. And for more information about the Parent Advocacy Program, contact Late Lucy at Verizon.net. Again, I'm your host, Ray Goodrum. Hopefully you've enjoyed the program. Good night.